So in this video, we're going to talk about mobilizing the sternum to either improve the ability for it to elevate or improve with inhalation versus with exhalation, depress with exhalation. So some people live in too much inhalation, basically, and their sternum's raised up, and they're doing this kind of posturing motion, and they become really rigid through the front of their chest, which then ultimately can cause the back to become restricted, and then the neck may become affected because of that, or the lumbar area may become affected. Okay, so some people are there. Other people are stuck in this relatively depressed position, which, there's a concept called a functional holding pattern. And so people that are typically more in this position, it's not always, but could reflect something about how they feel about themselves, but also they just may have poor posture. Okay, so we want to also have an option to be able to get that sternum to relatively come up to a more neutral position. We don't want them to be in this overextended position. We want neutrality of the thorax stacking over the pelvis. Okay, so we're going to go through both of them here. So I'm going to bring my hypothenar eminence here onto Kelsey's sternum. You want to get consent. So Kelsey, is it okay if I come onto your sternum? So I'm right onto the sternum here. And then I just want to feel, go ahead and breathe in. As she breathes in, we get some expansion, and then breathe out. And I want to follow that, and it does not want to go down as she breathes out. Okay, so that's just an easy assessment. Naturally, when she breathes in, does it raise up towards the ceiling? When it goes out, does it drop down towards the table? Okay, when it went in, it came up probably a 50% excursion. When it went out, it started going down, and then it just stopped. And so I'm like, oh, that's not good. I want to improve that infill. Okay. First things first, we are going to work to improve inhalation. Okay. Now, with inhalation, I'm going to take up some of the slack into her sternum. And then from here, Kelsey, I just want you to breathe into my hand. Go ahead and breathe into my hand, and I allow that to happen. I would start by just giving some proprioception into her sternum and give her somewhere to breathe. Breathe in. Good. So this is option number one. Option number two is as she breathes in, go ahead and breathe in, I can give her little quick stretches and out in order to help with that expansion. Now with the quick stretch, you need to have her, as she's breathing in, I'm giving a little bit of pressure. She starts to breathe in, and I maintain that pressure, and then I come off of it suddenly, and then because there's pressure built up, she immediately re-engages into my hand. I re-engage into the sternum, and she's still trying to breathe in, and then I come off of that a little bit. So it's like these little bit of impulses where you're trying to catch that sternum into a larger inhaled place. So go ahead and breathe in. And you kind of pulse it like that in order to really help that sternum to inhale and open up. Now there's also something called a quick stretch, which it's a similar thing, but you allow for a much bigger buildup, and you have to communicate with your client that you want them to do some max effort inhalation. Okay, so it's really like a forced inhalation. So go ahead and breathe all the way out for me, Kelsey. All the way out. So I'll follow the sternum down there. And now max inhale in. Good. And all the way out. And you cue them to breathe through their mouth on this one, whereas they might breathe through their nose before. Good. In. Good. All the way out. We make sure to get it all the way out. Full exhale. And in, max inhale. And then you suddenly release the hand, and then all of a sudden there is a bunch of air that floods into the alveoli and can help open some of them up from an oxygenation standpoint. For people that are more in this depressed position that don't ever get enough air in, they're just stuck in an exhalation relative position. Okay, so that is an overview of the fact that the sternum needs to be able to move with inhalation and exhalation, and specifically how I would treat to improve inhalation.